Bart Rose, fourth-year medical student, University of Illinois, Peoria.
Martinez, third-year medical student, University of Illinois, Peoria.
Michael Lintner, fourth-year medical student, University of Illinois in Peoria.
So by the end of today, we want to try to convince you that if you're still smoking, you need to quit.
Thank you, doctor.
And we're done. And we're done. And that's the presentation for today. A HEARTS program is a student-run outreach program that two of my friends and I developed.
It stands for Health Education and Awareness Resource Teams,
where we take teams of medical students out into the community and educate them on basic health knowledge.
You're 40 now, you're still young. Imagine 40 years from now you could continue to smoke.
Particularly, focusing on sectors in the community that might not have access to health care.
It's good to get your breast exams, annually. And we put on lectures to the public about basic health issues.
Diabetes, heart conditions, obesity, a lot of things that are very preventable.
These students, though, had the initiative and creativity to identify a need and then design a way to fill that need, recruit their peers to help them with that, and develop what I think will be a sustainable program, not just that these students ran, but that will be used by generations of students after that.
Somewhere between 10 and 20 people, I think, that we have found that weren't previously aware that they had high blood pressure, or that maybe they fit their criteria for being depressed, that maybe were at risk for stroke, or had high blood sugar at a screening event. So as more men started smoking, 20 years later, the same amount of men got lung cancer. We're students, and we're learning. We're learning how to teach. We're learning how to interact with patients. We're learning this material and sharing this knowledge that isn't just our knowledge. This is the knowledge that belongs to society, and it's our role as physicians to help people to understand what's going on with their bodies.
Hello, Mr. Burwitz, how are you? As a medical student, I feel blessed to be learning medicine, and to give back to the community is something that I've always felt I've wanted to do.
A great group of guys. They have excellent interpersonal skills and excellent enthusiasm. They have this sense of community, this vibrancy, and a pretty good sense of humor.
It is always better to get drugs from your doctor.
Most of the times, everybody who's there is very receptive. They ask questions, it's interactive, it's fun, we're laughing, it's a good time usually.
It's easier, I think, for us to explain it in a layman's terms because we were just laymen just a couple of years ago. So it's much easier for us to make that connection and say, this is kind of an easier way to think about how hypertension is because we just learned it. It's a pleasure seeing you again. This community is just so outgoing and overwhelming with their support that to be honored by people who are already this significantly involved in their community is a great honor.
Hopefully others, if they see this, they can realize that, maybe it'd be them here sitting in my chair, maybe it motivates other people to if you want to get recognized, go out and do something good for your community.